Let's talk about healthcare fraud.
Sure. Sure.
Because I know it's another part of your world that you've investigated extensively, and so
Yes.
have I.
Yes.
Tell me about how you became interested in it and what was sort of the biggest case you investigated, or one of the most colorful cases you've investigated.
Oof. We're going to be here for a long time if you do that. I actually was involuntarily assigned to a healthcare fraud squad. I didn't want to have anything to do with it. It sounded boring to me.
Why?
Right? It just sounded boring, right? I was an immature agent at the time. I was brand new, but I didn't know much. And
I guess the idea that who cares if health insurance companies or Medicare is being scammed, right? There's no actual bad guy behind
correct,
all this,
right? But
There's
then
not a face. Yeah.
Then you get into it and you realize, oh no, there are plenty of very, very bad people here. Why? Because there's money here. Not only is there money here, the worst part about it is the healthcare fraud that we were investigating involved theft from Medicare. So that's your paycheck, right? That's your money that's going to the federal government that's being stolen. One of the things the FBI established very early on when I was working these cases in 2004, 5, 6, at that time, the federal government's budget for health and human services / Medicare was $550 billion, give or take. Now it's over $800 billion.
Wow.
At that time, 10 to 15% of it was being stolen outright.
What?
Yeah, stolen outright.
10 to 15%.
Yes, yeah, stolen outright through fraud.
And that's all our money, basically.
That's your
being
money
drained.
out of your paycheck. So if you look at your paycheck, look what's going out for Medicare, and take 10% of that, and it's going in some dude's pocket.
And this is just Medicare.
Which ticked me off, by the way.
Of
That's why
course.
I was motivated newly once I found that out. Right? Like, oh, no.
Right.
My money.
And I think, when it's Medicare fraud, you kind of understand why people would get angry. I think sometimes what happens when it's health insurance scams or fraud is that people think, who cares? These are big companies. Nobody really likes health insurance companies anyway.
You're
Who
going to
cares?
pay.
But we are going to pay as well.
They got to raise your premiums. You're going to pay.
Right.
And I will say the health insurance companies do a better job controlling fraud than Medicare does. I remember getting to arguments with people from Medicare about thefts and losses I was seeing in cases. And their attitude essentially was, listen, this is how the system's set up. We really can't do a whole lot about it, which is incredibly frustrating, especially when you consider the largest healthcare fraud case I had was a husband and wife and maybe 30 of their associates tried to steal $400 million from the U.S. taxpayers. They got $200 million.
How?
They set up a scheme with, if I remember correctly, fake durable medical equipment companies. So picture this. You're a Medicare recipient. You go to a provider, a doctor's office, or a clinic, or a durable medical equipment company that sells artificial arms and legs. God forbid you have diabetes, you lost a foot, I need a prosthetic limb. You go to these providers. Getting a provider license was easy. It was a joke, right? Once you got that license, you have a license to bill Medicare. So they would do two things. One, they would either buy out a small business that was already existing and already had a license and just latch themselves onto that. That company may bill the government for $10,000 a year, $20,000. Now it's $1 million, right?
For these prosthetics or for...
There were no prosthetics. There was nothing. They're just submitting the paper. It's all paper.
But under whose name? Like, who were they pretending needed those prosthetics?
They would steal, because another thing I found out is there's a whole underworld where you can buy entire lists of patient names, social security numbers, dates of birth. They're bought and sold on the streets of Miami and other cities, right?
Right.
So you're an enterprising crook. You buy a small existing business that makes nothing, that has a license. You go find another guy on the street and you get a sheet of names. You get somebody who knows the billing process. You submit those bills to Medicare. You're going to get at least 50% reimbursement, which is what my people did. $400 million, they got 200, and it's in their pockets.
And there was no... They weren't actually spending any money or treating anyone or seeing anyone. Their operation was just filling
All on
paperwork
paper.
and
That's
sending
Yes.
it to Medicare.
They purportedly had 50 clinics, right? There were 50 locations that
Right.
they purportedly were doing business with. They were acting as the biller, and these 50 clinics owned by their 30 friends were legit businesses, quote unquote. I personally wrote all the search warrants for all 50 of those locations. There wasn't a damn thing in any of them. Right?
Nothing. There was no...
Little shop, little sign. A couple of them had maybe some paperwork, an artificial limb or two. There was no business being conducted. Nobody working in there, nothing. It was all
They
fake.
weren't even trying to hide the fact that they were doing this. I just saw a very similar case we were investigating these rehab scams all over the country, and we landed actually in Arizona, where because of the Native American population there, it's very easy if you're Native American in Arizona to actually get insurance. Because of COVID, they were trying to make it easier. So all you needed to do was give your Native American ID number, make a phone call, and you'd get insurance, and pretty premium good insurance.
Yeah.
So there were all these bad actors that set up these sober homes and rehab facilities that weren't actually real, and they weren't actually providing treatment for the most vulnerable of people, people who actually had drug addiction and alcohol addiction and really needed that help.
Yeah.
And they would bring them into these rehab facilities and charge insurance or Medicare for sometimes, like we heard, $10,000 a day.
Yeah.
And provide nothing.
Yep.
We heard of some Zoom calls that they were having, that their therapy sessions were Zoom calls, where 400, 500 people would be on these Zoom calls with one doctor or one therapist.
That's pretty bold.
It is so bold. I mean, but not much more bold than what the story that you just told. Yeah. And again, it's like exploiting unintended consequences too, right? Because they're trying to do good and make it easy for people to get the insurance and the help that they need.
Yeah.
But at the end of the day, there are people just lurking around the corner trying to make a buck.
One of the things I neglected to mention before, I can't speak for the Native American population, but here in Miami, one of the things we also saw is that the patients, the Medicare beneficiaries themselves, were in on the scheme a lot of times. So the fake providers would not only buy lists of information off the street, but it was not uncommon for them to go down to certain neighborhoods with a van, round up some homeless people or homeless-looking people, or just old folks in an old folks' home. Hey, we're going for a ride, casino, whatever. And then it will give you $200. Just go visit this clinic.
Right. It's body brokering. We saw the exact same thing in the rehab industry, the exact same thing, where people, former addicts or current addicts, were being paid, here's $100, go look for people on the streets. A lot of times it was homeless people in California or in Arizona, and they would bring them to these fake rehab clinics.
And they don't care, because it's not that they're paying a premium out of their pockets, right? They're seeing a $200 when they don't have any money, and they benefit from it, right? And sometimes they'd round these people up once a week and hit these facilities. And I talked about durable medical equipment. That was a big scam back then. They've moved on to other scams. Another scam, I had one guy put in prison. He was running a fake laboratory. So he was associated with sober homes who said, okay, we're a sober home. We're going to do drug testing for all our patients. We're going to send them to this lab.
Is it the urine testing?
Yes.
Was it urine?
The urine
It's
test.
called liquid gold, actually, in the rehab world, as
Correct.
you probably know.
Exactly.
I've heard about this too. We had one of our whistleblowers who told us about, she had been in one of these sober homes run by one of the worst actors in California, who runs many of these sober and detox facilities.
Yeah.
And she was telling us, that they would basically give her weed and drugs on the way to get her urine test, because they wanted it to test dirty. First of all, they wanted everyone that in their care to do it like once a week, because they could charge insurance $1,500, $2,000 per urine test, hence liquid gold. But also they would give them drugs, so they would test dirty, so they would go through the cycle of detox, because you can really charge insurance through if you put a patient through detox. And people were dying and overdosing.
And one more time, nobody cared.
And nobody cared.
Yeah.